when we get done with their hands-on, before I feed them, I usually reposition them, just because you wouldn't want to lay in the same position all day. So we try to reposition them for their head molding and comfort. And so I'm just going to put her to where she can lay on her side for a little bit.
Well, because you were supposed to go and somebody wanted to.
Yeah. Shall we go this way? And so they can lay on their bellies. They're on a monitor here, so back to sleep is a little bit different for us, although babies are transitioned to their back to a crib without anything in their bed. We teach parents all about that. But while they're in here, for comfort and appropriate development, we can tuck them in various ways. See her sucking on her too? Mm-hmm. I'll give her pacifier here in just a minute, just so she can associate getting a full belly with suck swallow. We do a lot of primary nursing here, and so we can sign up for the same baby. Hang on. Here we go. We can sign up for the same baby and be the primary nurse, so every time we come in, we have the same patient, which helps with continuity of care. And the parents generally like that too, so they have a face with a name when they call and they can't be here. But then when you're on deliveries, you don't necessarily know what you're going to get, so that can be exciting too. So there is a lot of opportunity to do various things in the NICU, as far as you can take babies that are different gestational ages. You can take a baby based on a diagnosis maybe that you would like to learn a little bit more about. Nurses usually gravitate to particular types of patients, you know, based on what their comfort level is and what they like. So it's really fun. There's always something to learn, and generally there are nurses that have been NICU nurses on our floor forever. It's the only job they've ever had, so you can always learn from somebody, and then there's newer nurses that are always coming in, so you can always teach somebody, and I like that part of it too. Here in the NICU, by doing little things, we'll scrapbook pages and photos of special moments. A lot of times we'll try to get the first day or two of babies here and scrapbook that. If they have a milestone, such as taking a bottle for the first time when the family's not here, we'll wash out that bottle, soap and water, let it air dry, and put little glitter in it and make a little tag. You know, I took my first bottle on such and such date as a memento. If kids are here for long periods of time, we will work on doing their footprints or handprints maybe for a 1 month, a 2 month, etc. scrapbook to try to help them not miss the moments that they might have had at home. We try to encourage them to do hands-on cares at the bedside with diaper changes and temperatures. We help them participate in baths, you know, even small things like bringing a handful of fleece for their beds and saying, okay, which one do you want for your baby tonight? If they don't bring clothes, we have clothes for them to choose from. When my parents leave, I usually let them sit together as a family and take their picture so they have a day of discharge picture to go home. So I think it's the little things that definitely count here. So most days when I leave, I feel like I've done something good for a baby or a family. Even for another nurse, we're pretty good about helping each other out. There are far more good days than bad, but on occasion you'll go home and kind of feel defeated that you didn't have the outcome that you necessarily wanted, or that you had to see a family go through pain, or that 3 little bitty babies kind of bullied you all day long and kept you really busy. So, but for the most part, it's quite enjoyable and very rewarding. I often wonder to myself if I can do this particular ICU and nursing job until I retire, because it is stressful, but the rewards of it far outweigh the stress. And I think that if you can do it now, in some aspects you kind of owe it to your patients and families, because it is a gift that you have to keep taking care of them and their families.